Testing 1, 2, testing. Testing 1, 2, testing. Testing 1, 2. Hi, I'm Terry Murphy, and thank you for joining us. And with today at Realty Times and Women in Business and Women in Real Estate especially, we're talking with Gary Burrus, Ph.D., who specializes in strategic human resource management. And with the current issues that are affecting companies, corporations, and just every small business out there, I asked Gary to join us today to give us some points on how to handle the health epidemics that we're experiencing right now. And Gary, you talk about people, and what do you mean by that?
Well, people are the heart of every organization. And so for that reason, I tend to advise clients and people I work with, people first, because in this particular health crisis, it's continuing to unfold. So what we're talking about today is going to be modified by what comes out tomorrow. But people in organizations are looking for leadership and guidance and some form of assurance that the leaders that have been placed in the privileged position of leadership over them know what they're doing and they have their best interest in hearts. And that is your customers, that is the people that work for you as employees, and those are your vendors in those particular cases, organizational leadership is important during unfolding times like this.
Well, you also talk about flexible work attendance and how maybe distance connection using platforms like we're using right now that can help connect people and still, keep the flow of business going.
Right. What the research that I've done in dealing with working with colleagues of mine, talking to my own clients, is what I'm advising every organization to do right now is to understand it's not raining frogs. This will eventually pass. And once it does, people are going to remember how you treated them during this period of time. So I'm advising my clients, first is people, 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 as we just talked. That means you need to educate your employees around this. You need to give them timely information so that they can make decisions. Now that includes being flexible in schedules. Typically, most organizations want people coming in during predictable times, but if you are a volume-based business, if you are working in any form of hospitality business, you can expect that since they're actually telling people to keep social distances, your business may be impacted by the next few weeks, at least, people deciding that they're not going to come as often as they used to. So now's a good time to work on flexible scheduling. Now's a good time to review just how hard you're going to be on employees that choose to call out because they say they're sick and not bringing in a doctor's note, that sort of stuff. So people, people, people means educating, informing, and making allowances for their needs during this particular time. Because at the end of the day, everybody will remember how you treated them during the down times when you need them during an uptime. So well, people is number one.
Yeah, you bring up a really good point about leadership. And we know from the Lencioni's book on the 5 dysfunctions that the absence of trust is really the key here. And so what I'm hearing from you is that the people, and you say privileged leadership, they are tasked with, I need to trust you. Right. And so that brings up a really good point. The second point you brought up was clean, 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 which of course, I'm a certified bleach carrier, but go ahead.
Right. So if number one is people, 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 number two is clean, clean, clean. And during this particular time, that's really all you can do. So there is great guidance out there from the CDC on what they're recommending in terms of cleaning. The research I've done, a lot of organizations that are customer-centric organizations, that is in hospitality, they are definitely following the CDC guidelines on how frequently surfaces are wiped, high-touch surfaces, upgrade, taking a good look at your cleaning chemicals, upgrading the cleaning chemicals to CDC recommended cleaning chemicals, and then you have to really step up the amount of cleaning that takes place. So people's number one, you look at your organization, your values, and how you're going to execute taking care of them. Second is clean, clean, clean. And if you did it once a day, now's the time to completely step that up. Now there's great information out there from national organizations such as Ecolab that actually supports what the CDC is telling us. Ecolab has some very good recommendations for organizations on cleaning. That's a great national resource. Regionally, I know you're in Memphis. In the Memphis area, there's an organization called Team Mobile. Team Mobile is a regional cleaning company that handles hazardous material cleaning, medical cleaning, those sort of things, and they do training in that. So you got the CDC, you've got several respected organizations, but if people's number one, clean, clean, clean during this time is number two.
And you brought up a really interesting point in our pre-interview about the evidence of people cleaning. And I think that gives people so much less anxiety. Why don't you elaborate on that just a moment?
Right. So if we've covered that people is number one and that cleaning is number two, number three is you need to be seen peopling and you need to be seen cleaning. The research I've done is in hospitality, for example, several customers interviewed for in different regions of the United States said that when they walked into certain places, they didn't really notice anything necessarily different. So having hand sanitizers out and available, and a lot of them right now, whether they use them or not, it gives customers the feeling of comfort that you're taking it serious. But being seen peopling inspires confidence in your company. Being seen cleaning inspires confidence in your company. So you have to be seen doing this, and it needs to be noticeably different in the eyes of your customers and noticeably different in the eyes of your people.
And I would say visible. I think that that's a really important factor because that builds that confidence and helps reduce the anxiety. Well, Gary, you've been so valuable here. And I know that if someone wanted to contact you to get more information or to hire you for your consulting services, how would they reach you?
You can reach me through GCW 1996 at, all right. Can we stop for a second? I'm sorry, Tara.
No,
I have still not.
Well, Gary, that's really interesting. You've got those 3 points. Let's talk a little bit about the 4th point, which you talk about is reviewing business continuity plans. What do you mean by that?
So business continuity assumes worst case. It doesn't necessarily focus on exactly what causes the business to be disruptive. It assumes that something has disrupted your business. So a business continuity plan, you need to review that now to say worst case scenario, if your business suffers a downward trend or a closure as a result of the coronavirus, what are you going to do about it? It's better to do those now before the pressure hits you, so that you can make adequate plans for your people, for your customers, for your vendors. So I would say break those out, dust them off, and review what you would do worst case scenario.
Yeah, it's critical to pivot, obviously. And the last point, the 5th point, you talk about putting somebody in charge of the changing government regulations.
Right. So some of my clients are very small, and they don't necessarily have a department, a risk management department, or a regulatory affairs department that will do this. So it's important that every business owner, regardless of size, continues to follow what the World Health Organization, the Centers for Disease Control, and the United States government is suggesting as this continues to unfold. And then at the end of the day, remember, this too will pass. How we treat people, how we treat our customers now is going to be important.
And Gary, I personally think there's going to be some evidence of massive changes that are coming from this impact right now, which I don't think are all negative. I think there's going to be some revelations that'll help people stay connected without necessarily worrying about the impact of something globally that's negative, like what we're experiencing right now. So I'm assuming that people may want to contact you to get a little bit more information or consult with you to figure out what they can do best in their company or association. What's the best way to reach you?
The best way is through my email, GWCM
1996 is what I've got.
That's right. Hold on one second.
Well, Gary, it's clearly evident that we are not even remotely aware of some of the innovations, changes, strategies, revelations that are going to happen from this global impact that's happening to companies both small and large right now. And I'm just going to offer that you have consulting services, and what would be the best way to reach you?
The best way, if people have questions, perhaps I can direct them to the right resource. But for questions or anything I can do to assist, the best is an email, gwcm1996@gmail.com.
That's George Washington Cat Mom at Gmail 1996@gmail.com. I want to thank you for your time and for the research that you've done on this to give it such credibility. I want to ask if we can follow up later with you, because I think there's going to be later developments, and with your research and your experience and your relational capital, I know we're going to want to hear more from you. Thank you so much.
My pleasure. Thank you very much. I would be bringing in third parties. I'd be cleaning the hell out of everything every 3 minutes, praying to God that it doesn't show up in my business. Where I'm at right now, last weekend, we were supposed to have an Asian themed weekend, and we were expecting, I forget how many, I think we were expecting